Dr. Carr. I am an OBGYN. That means I practice women's health. I'll get a little bit more into that later. But I wanted to kind of talk about what a doctor is, what a physician is, and kind of how we get to becoming a doctor. All right. So I'll talk about what is a physician, how do you become a physician, what are the different types of physicians, what is obstetrics and gynecology, and then what can you do now to learn more about medicine and healthcare and potentially start that journey to becoming a doctor or a physician. So when I say physician, I'm talking about a person who's completed their graduate education or their graduate training to become a medical doctor or an MD, or a doctor of osteopathy or a DO. So in the great state of Iowa, we have both medical schools here. So the University of Iowa can give you a degree, medical doctorate degree. And at the Des Moines University, you can get your doctor of osteopathy. So there's two great options here in the state, and both can allow you to practice medicine in a full scope of care. So there are other types of doctors. So when you hear the word doctor, don't always necessarily assume that they're a doctor of medicine or a doctor of osteopathy. You can be a doctor of veterinary medicine. You can be a dentist. You can get your doctorate in medicine, physics, history, engineering, nursing, you name it, you can probably get a degree in it. And they have the name doctor as well. So that term doctor can be used for lots of different things. And so when I'm going to be talking, I'll say more physician, but I may say doctor interchangeably, because when we go to the doctor, who you're really seeing is a physician. So how do you become a doctor or physician? So before you go to medical school, first you got to graduate from high school, or sometimes people have other life things that get in the way, and then they have to go get a GED. But ideally, you're going to do well in high school and then try to go to a college. So that can be a four-year university, like the University of Iowa, like Iowa State, or you can go to a two-year college or a community college and then transfer into a four-year institution and take all your classes that you need. So you can major in anything you want. Don't think that you just have to study something science related. I personally got my degree in biology because I loved science, but I also did a minor in something called religious studies. So you can study whatever you want, as long as you're making sure that you're taking the classes that you need that is going to set you up for success in medical school. So chemistries, your physics classes, and biology classes, okay? And then while you're both in high school and college, make sure that you're exploring other careers in medicine and other science careers and fields so that you know that medical school is what is right and best for you. So there's a hierarchy and kind of a journey that you'll take. And we'll kind of talk about the different stages that one can be in their training. So next step would be becoming a medical student. And ultimately your goal is to become an attending doctor. So someone who's practicing on their own, doesn't need direct supervision from someone else a little bit higher above them. So kind of what happens when you go to med school. So after you get your bachelor's degree, while you're usually still in undergraduate, but some people work between, you apply to medical school. You complete all those prerequisite courses like we talked about, biology, chemistry, physics. You take an entrance exam called the MCAT, and then you apply for a medical school. So once you get into medical school, it's approximately 4 years. Sometimes it can last a little bit longer. Doesn't usually happen any shorter, unfortunately. And are a couple few rare programs that are combined undergraduate education and medical school into a 6-year program. You have about 2-ish years or so where you're doing more book work and kind of learning some basic clinical skills. And then your third year, some of your fourth year, you're going to be rotating, what we call rotating, or getting kind of 6 to 8 week kind of fields of different types of medical specialties, what we'll talk about. Then when you're in your fourth year, you're going to apply for something called residency. We'll talk about what residency is in a second. And really what that residency is a way to help you figure out what type of doctor you are going to be once you're that full attending or full-time doctor. So there's lots of different types of physicians, lots of different types of doctors. So common doctors, some doctors that you may have seen already, include your family medicine doctor, the doctor that may treat you, your mother, your siblings, pediatrics. So that means people who are under the age of 18. Internal medicine doctors treat adults only and non-pregnant women. from 18 and beyond, sometimes more complicated issues. There's other doctors that help people put people to sleep for surgeries or help with pain control, help with brain, help other doctors learn how to interpret images, such as radiologists, people who focus on just the skin. And most of those types of doctors don't do a lot of surgery, okay? And then there's more other types of doctors called that do more surgery, general surgeons, OBGYNs like myself, and they tend to focus on certain areas of the body. Within each of these specialties, and there are more, you can even do even more sub-focused training in those areas and focus on even smaller areas of the body. So like I said, you have your folks who focus on the moms, the babies, and both. People who may treat cancer patients, people who help you if you have a sports injury, people who can help you see better, help if you have problems with your eyes, as well as your family medicine doctor that can take care of kind of a full scope and range of issues. So residency. Residency is kind of a training time where you're kind of under someone's wing where they teach you how to develop all the skills that you need to be a successful doctor after you're done with that residency program. So after you choose one of those specialties on that list, you're applying for this program, you're going to do something called the match, where you apply to all these different programs, you interview at lots of different places, and then they choose you and you find out on a magical day called match day, where you're going to be spending anywhere from 3 to sometimes 9 years of your life learning your craft, okay? And then after residency, you can either become what we call an attending physician, so kind of already on your own, working full time, or you can do an even more kind of subset specialty called a fellowship, where you're going to do even more training. So depending on what type of doctor you want to be and what organ systems or pathology you want to focus on, you'll have that additional training. Surgery residencies are typically a little bit longer than non-surgical residency programs. So if you're going to operate, plan on being in that program for a little bit longer, but that isn't always the case, okay? So I am an obstetrician and gynecologist. So I specialize in the care of women during pregnancy and childbirth. I also treat diseases for the female reproductive system. I see patients in the office, I see patients in the hospital, in the emergency room, and I perform surgeries and deliver the babies, okay? So I get, what I love about OBGYN or obstetrics and gynecology is that I get to see patients throughout their lifetime. I see women and children as young as sometimes 10 years old who are having issues, all the way up to your 89-year-olds who are having problems with their reproductive organs. I get to follow and see people in good times and in bad times in their life, and I'm able to form a bond and relationship with them, as well as getting to do some surgeries as well, which is really, I like to work with my hands. So it's a really good specialty for me. So my residency was 4 years, and even some people decide to do more fellowships like gynecologic oncology, women with cancers, helping women while they're pregnant who have complicated issues, women who are having problems with their bladder, and then women who are having problems getting pregnant. I got a little video. Let's see if this works.
This is the checkers game where grandson and granddad will bond.
Let's see here. All righty. So this is an ultrasound of a baby that's around 16 to 17 weeks inside the womb. Inside the heart. So you're able to see kind of the baby move. This is the baby's head right here and face, heart. You can see the eyes. That's how you can see the lips. You can see all this just with a little machine. There's, as an OBGYN, I get trained on how to do these ultrasounds in my training during that residency time. And then there's also people who go to school specifically to learn how to do ultrasounds as well. So that's an option if you decide that you like to be in the medical field, but you don't necessarily want to become a doctor too. This is the baby's brain that they're showing. So they're measuring that because that lets us know how baby is growing. And this is around the time where they take a look at baby from head to toe to make sure that baby looks okay inside the womb. This is the placenta, and that's baby's femur. Okay. They can also tell if the baby may be a boy or a girl from these ultrasounds as well. So at this point in this mom's pregnancy, her uterus, or where she carries the baby, is right around her belly button too. I'm just going to keep showing different stuff. So this, they're measuring the baby from the top of the head down to the bottom, and that helps them figure out how old the baby is at this time as well. Once the baby is still inside, we call the baby a fetus, but once it's delivered, technically it's when we call it a child. Baby's spine. Baby's legs are down there. That's the mama's bladder, where she's gonna pee from a little later. This is the opening to the mother's uterus. So what opens when moms are delivering. Okay. I should probably close that. It's going to start playing. But what can you do now to figure out kind of why you're in this stage in your life? So talk to your doctor about like why they like their job. That's how I started. I started to ask my family medicine doctor why she liked to do what she did. Pay attention in your math and science classes. In high school, do your best to get good grades so you can get those scholarships, so you can afford to go to the college and go where you want. Volunteer in healthcare spaces so you get a better exposure. And then ask to shadow your doctor or healthcare provider when you're in high school or early college. And remember, just because you're going into medicine or think you may want to go into medicine, make sure that you can study whatever you want as long as you take those courses. And don't let anyone tell you that you can't be a doctor if you're doing everything that you're supposed to be doing and getting the grades. Don't let anybody discourage you, because it's a hard journey, but you can do it.
Your baby grows and changes fast during your second trimester. Here's an inside.
All righty. Do you guys have any questions?
When you deliver a baby, what's, I guess I'm thinking of premature. What's the youngest baby you've ever delivered?
The youngest baby I've ever delivered that we think will survive outside of the womb is right now is in 22 weeks. I think the youngest one that I've delivered was about 23 weeks. And pregnancies last up to can last up to 42 weeks. What we consider a full-grown or term baby is 39 to 40 weeks. So that was only a little bit more than halfway through the woman's pregnancy.
In the development of a child, do certain organs or things develop before others? So at that stage, at halfway through the development, do they have like maybe their heart functions, but not their liver or something?
Yeah, absolutely. So at that stage, at about 23, 22 weeks, the biggest concern that we have is that all the organs are there, but are they mature enough to sustain life outside? So sometimes once babies are born, they can't breathe on their own. They don't have the muscle strength and they aren't yet ready. Their body wasn't ready yet to make the certain kind of hormones and proteins to make the lungs work. Or they haven't grown fully yet to be able to supply oxygen to the whole body. So that at that point, once they're born at that time, sometimes we give mamas some medication that can help before labor. And then once they're born, they go to a pediatrician who specializes in very early or complicated babies called neonatologist. And then they help them kind of get through that process with either a breathing tube or extra some machines that will help them breathe. Sometimes babies' brains aren't all the way developed, or the blood vessels aren't very mature. So then the blood vessels can break or bleed. So they will watch for babies to make sure they don't have brain bleeds. And also the belly or the gut. sometimes doesn't have the right bacteria in it yet. And so babies are watched very closely after birth to make sure that they're not developing infections or having problems with their bowel or their gut.
Thank you. We do have 2 questions that came in. One is from Myrna. She wants to know, where is your practice?
Yeah, so I currently practice in Genesis in Davenport, Iowa. I'm originally from Des Moines, but I practice in a group up here with 4 other doctors, and we get to see patients from all walks of life, and it's a very rewarding gig.
And another question is, what do you enjoy about your job?
Yeah, well, like I was kind of saying earlier, I really like to do surgeries, but I don't like to be in the operating room all day long. So I get to do lots of short surgeries that are like typically 2 hours or less. I get to meet patients when they're just deciding if they're trying to get pregnant. I get to see them throughout their whole pregnancy process. I get to deliver their baby and then see them afterwards and continue to have a good relationship with them. So that's something that's very rewarding for me. Or some doctors either don't get the chance to meet their patients at all if they're pathologists or radiologists. You never see them face to face. They just kind of have either an image or tissue samples that they're looking at or blood work that they're looking at, or some surgeons see their patients and they don't really get to see them much. So that's, to me, OBGYN was a good merge of 2 different worlds.
So is your job at anything like we would ever see on a television show that's about doctors or hospitals or anything?
There are some aspects that are somewhat accurate, but if you watch a baby being born on TV, it's not usually like that. Yeah. So it's not usually as chaotic as they try to make it on TV. Sometimes it can be, but not usually.
Do you see very many multiple births, like twins, triplets, so on?
Yeah. So here in my practice here, we deliver twins. Because of our hospital system, sometimes twins, or if there are more than just 2 babies, or if they're 2 babies, but depending on what type of twins there are, like if they're fraternal or identical. I know some of you guys may know friends who are twins. If they're a boy and a girl and they're fraternal, and those pregnancies are a little less complicated. Sometimes 2 girls or 2 boys can have more problems when they're inside. So sometimes those babies go up to the University of Iowa because they have more specialized care that they can give immediately with the doctors for the babies. So, but when I was in residency, we had a mom who had 4 babies. At once, and so it definitely happens. We have triplets that we take care of, and then sometimes they deliver at the University of Iowa. But yes, definitely love delivering twins. It's fun.
I think that would be, yes. I don't see any other questions, but if anybody wants one, they can either unmute their mic or they can write it in the chat.
I have a question I can ask. If you had to give any of the youth that are here or any of them your biggest piece of advice for if they want to be where you are someday, what would that be?
Just don't give up. You may have people in your way who may tell you that you can't become a doctor or it's too hard. And it is a long journey, but it's kind of like running either a sprint or running a marathon. Becoming a doctor is a marathon, and you have to really, really want to do it. The money, for some, prestige is not worth it if your heart is not in the job. So make sure it's something that you really, really want to do. And that you know that it's something that you're going to work hard for, and that you care about working with patients. And then if you're liking science and if you're staying dedicated to your studies, it will likely work out.
There's a lot of overlap with that too. So we have, high school, and then 4 years of college, 4 years of dental school. The cool thing about dentistry that makes it a little different is that after 4 years of dental school, you're just ready to rock and roll. So you can go on to do specialty work, and I'll show you a couple different options and whatnot. But if you're just doing family dentistry, AKA general dentistry, then you can just go right on out. And the reason why is dental school is very hands-on from your first semester. So they start you out with easy stuff, and you're doing hands-on tasks, getting you ready for clinical work from the first semester. And so by the time you get to your second year of the 4 years in dental school, you're already doing fillings on people, and you've already done cleanings your first year on people, and you start on your own classmates. You kind of trade off and practice cleaning each other. Then you see patients. At the University of Iowa, which is where I went, they have a lot of senior citizens come in for free dental work, and they love, coming in and just socializing with the students. They'll bring you treats and stuff too, so it's kind of fun like that. Now your third year, then you go around to the different specialties, and you do a few weeks here and a few weeks there, and you do all the different specialties. Then your fourth year, you get a group of 50 patients, and your job is to comprehensively take care of their whole care. So that's kind of how dental school works. You do 4 years of regular college, and by the time you get to dental school, you call that undergrad. When everyone else is calling it college, you're still in college in dental schools. So then you say, well, that was undergrad and this is dental school. Then you can do anywhere from 2 to 4 years of specialty work depending on what you're doing. So oral surgeons finish their MD degree, and so they do 4 years of residency for their oral surgery degree. Some of the specialties are as little as 2 years, for example, orthodontics. So I'm going to switch over to my presentation here, so that way we have some content to talk about. Let's switch to optimize video. I'm going to share sound. Hopefully it doesn't drown me out. That's one concern of mine. But so right now, I just made this presentation earlier, and I was talking with students before about 21st century dentistry and what that means. So what's really cool is there's new stuff happening within physics, within chemistry, within the artistry of dentistry, and we're going to talk real quick about the specialties. And even, there's engineering involved. So the cool thing about dentistry overall is that it's the culmination of art and science. A lot of times you own your own business, and you have to be good with people. So your interpersonal skills, if you're in junior high or high school, they might not be as polished as someday when you're an adult. But at the same time, you do have to enjoy people. And that doesn't mean you have to be an extrovert. I am, but not everyone's an extrovert, but you can do well at dentistry if you are good at interacting with people. And it's just one person at a time. So you don't have to be good with large crowds. But it's important to know that you are definitely dealing with people all day long. And by the end of the day, anymore, now that I've been out of school for 16 years now, I'm ready to kind of wind down at night. So doing this kind of interaction is easy enough because it's kind of one-on-one since it's Zoom. If you have any questions, by all means, feel free to pop it down at the bottom, and let's scroll through. If I can get down to the bottom of my screen, there it is. Okay, presentation. So there's
Sirona Dental System.
There's a certain kind of camera that you can use that takes pictures of your teeth, and it 3D maps your teeth. So that way we can make teeth on site for people. So as you can tell, this camera is 3D mapping, and I'll just ask, if anyone can unmute themselves. Can you guys see what is going on?
Yes.
Okay, just wanted to make sure. I didn't want to be going for minutes on end and think I'm helping out and then find out it's not. So this camera helps us 3D map teeth, and then we also have a milling unit that would allow for us to, I'm trying to see if it has it on there, that would allow for us to mill the crown the same day. It also lets us make other things like veneers, bridges, implant crowns, stuff like that. So that's called the OmniCam. This is just some of the technology that makes dentistry fun. So dentistry is very hands-on, and it's very high-tech. The Galileo's cone beam CT is something that's newer in dentistry in the last 10 years. it basically lets you three-dimensionally overlap the scans that you took of teeth to be able to replace teeth with dental implants. So a DDS is what a dentist's degree is, and it's a doctor of dental surgery. So surgery is when you're changing soft tissue and hard tissue on the body, and normally it implies on for a permanent sense. So dentistry is a surgeon, and dentists are surgeons, and they're doing dental surgery. Even fillings technically are changing your hard tissue of the tooth. And so you've got soft tissue like your cheeks and hard tissue like your bone and teeth. And so so surgery is involving changing those. And you can see here that, we work with a lot of radiology, and then there's these surgical guides that we can make. I do these about 3 or 4 a week, and which is a lot more than a lot of dentists. But basically people come in and get the 3D scans of their head done with an X-ray. And that's X-ray is the nice, easy word for radiology and radiography. And so then we make these surgical guides that the lab technician makes. And right about here is an example where the surgical guide clips onto the patient's teeth, and then it leaves this little hole right there that allows for me to place a dental implant into the bone. When the dental implant heals, it's just like a prosthetic knee or hip joint, and the bone and titanium fuse, just like in the mouth, and then we can put a crown on top of it if someone's missing a tooth. So that kind of goes to show you, some of the stuff that we can do for placing dental implants. So that way, in the end, we can give a patient some teeth where they weren't able to have teeth before. Next. Loading, expand, and next up, artistry and dentistry. And I'm going to put this on mute. Good. There's a lot of artistry in dentistry. And so this was an attempt to show you that within dentistry, we are customizing teeth all the time. I think people assume that teeth are tooth colored. And so when we're trying to match a tooth, a lot of the patients will say, well, just make it tooth colored. Well, there's, a ton of different shades that we're using. And it's not just about the color that we have to match. You learn in dentistry that there's hue, value, and chroma. Those are 3 fancy words for different aspects of color. So it's not simply about the color, it's what kind of color does it cast in different light. And if you want to Google that later, hue, value, and chroma. And I'm trying to see if I can't find a place to park that. Let's see, in the discussion topic. It looks like I can only do so much at a time, so that's probably a good thing. So artistry. Next, Invisalign. As you guys know with your friends, so I won't go much into it, but you can get your teeth scanned with that scanner that I showed you, and have, yes, play. There we go. And have these plastic aligners move your teeth, and you change them out either every 1 or 2 weeks. And over time, we can move teeth from one position to another, so that way it straightens your teeth out without having to have the metal wires on there. But there's some background work that the dentists do. I think a lot of times people think, well, just make them straight. And it's like, well, it's a lot more complicated than that. We just try and keep it easy because there's no reason for you guys to know all of that as a patient. It would bore you pretty much. So that's the a topic that's worth checking into dentistry, is because orthodontics. An iTero scanner is a certain kind of scanner. We'll just skip that. Different types of specialties. So let me back up here. Specialties in dentistry include dental public health, no colon there, my apologies. Endodontics, which is doing root canal treatment. Endo means within the tooth, and dont means tooth, so the study within the tooth. Periodontics talks about the perimeter of your tooth. The 2 main tissues that we're talking about for periodontics is your gums and your bone. So if people have bone disease, gum disease, that kind of stuff, There's oral and maxillofacial pathology, oral and maxillofacial radiology, oral and maxillofacial surgery. So an oral surgeon, that's this one. The oral pathology would be someone that you would send a sample to have them look under a microscope to see if, for example, something's cancerous or if it's a viral kind of infection kind of thing. For example, a lot of head and neck cancers end up showing and manifesting, and dentists can find those. Unfortunately, a lot of them are secondary cancers, but HPV is a large cause for throat cancer, and it's one that dentists often find. So a lot of times people think, well, dentists really aren't that that involved. They're just fixing teeth. And that might seem true, especially the younger you are, that you've just had a filling here or there, or that might seem like what a typical dentist does. But a lot of dentists are looking for oral cancer, and April is Oral Cancer Awareness Month. So it's a great month for us to kind of delve into that subject. And we are helping save lives. It was there was a Seinfeld episode 30 years ago that was joking around about how even dermatologists don't save lives. And she said, yes, we do. I do skin biopsies, and we turn it in and find cancer. And it's the same thing in the mouth. A lot of times dentistry can be looked down that, we're just technicians of the mouth, and to some degree we play along with it because there's some truth to it that, we don't have as much liability and stuff. And that actually is a perk so far as I'm concerned. But we do more than just look at whether you have happy teeth and whether you have cavities. We're looking around for example, for oral cancer. There's other pathology than just cancer too. The middle one for oral and maxillofacial radiology. So those 3D x-rays that we took of the head, if I see something that doesn't look symmetric and that doesn't look normal, and where the tissue should go, so you have to know your anatomy. And you're taught that. If it doesn't look right, then you send it to a radiologist. And we basically just email the file to the radiologist. The cool thing about their job is they can look at it on the beach. It wouldn't be the best place to look it over, but we always joke that a radiologist can kind of work from the beach if they wanted to. They'd want to dim the lights so that way they could maximize their eye contrast to be able to see it. Orthodontics is braces. You guys know that. Pediatric dentist, most of you might know that. Pediatric meaning child, so dentistry for children. They also take care of a lot of special needs patients. And prosthodontics. This is dentistry involving prosthetics. So really what's cool is they're throwing a lot of harder cases, but even patients, for example, if someone has a cleft palate and a cleft lip, and we take for granted that when we swallow, we have a roof of our mouth, but cleft palate and cleft lip people sometimes don't have the roof of their mouth. So prosthodontists make obturators. They're these dentures that people wear that go up into the roof of their mouth like a retainer, and it sometimes plugs up into their nose. So that way, when you swallow, the liquid isn't going up into your mouth. And they even have to do this with pediatric patients. So if there's someone born with no roof of your mouth, just think about how do you feed this child so that way they can gain the nutrition that they need. And if they were to swallow, it would just come right out their nose. And then that's frustrating for the baby, frustrating for the family. So a prosthodontist helps make that in transition. And the baby's growing, so they have to get that made frequently, as the child is growing. Just as a mouthpiece for sports might not fit 6 months later, the obturator might not fit. That is a lot of stuff going on, and I just thought that I'd switch back over to chat section, and I'm glad to look at any questions that you guys might have. Sorry, that was about 15 minutes of my talking. So I'm just curious, do you guys have any questions, whether it's from the facilitators or anyone else?
We do have some questions from our viewers. And one is, and this is a good question. Why do dentists feel around your neck and jaw before a cleaning?
Thanks for asking that, Myrna. Also, before I get carried away too much, Tiffany Birkenes was the one that referred me. If any of you guys in 4-H know her, thanks to Tiffany for getting me plugged in with this tonight. I've known her forever. And so, yeah, thanks, Tiffany, for the opportunity to do this.
We will tell her that.
What's that now?
We will tell her that.
Yes.
Work with her, yes.
So why do dentists feel around your head and neck and jaw? I hope that's self-evident. Basically, we're also feeling for lymph nodes that might mean that you're sick. We're also feeling for asymmetric kind of stuff because we're trying to see, you know, like, do you have any throat cancer? Do you have any? It always helps to, we're not just fixated on trying to find cancer because it's not like cancer patients, you know, like we're going to find it every day, right? So it's this rare opportunity. Seriously, I've found, in 16 years, I've found 3. And every time that you find one, it's scary because you go, what if that's the next person? And you get to thinking after 10,000, you know, like no's, that all of a sudden when there's a yes, it's like, oh, crud. You know, you really have to keep your diligence up. So so that's what we're feeling around for. Kudos to the people that do have dentists that are feeling around for that, because that really is standard of care. We're, you know, trying to raise the bar on that, because again, we're not just trying to be tooth checkers. I think our job would actually be super easy and almost boring if all we were doing was feeling around for cavities. So that's worth mentioning. So how long is training and schooling for dental hygienists and lab techs? So lab technicians, I believe, is either 2 or 3 years. Lab technician schools are really shutting down by and large on a national scale. It's a very dynamic job position, meaning technology is really changing the job of a dental technician. And it is hard. They don't get paid what they should. And I have a feeling as there's fewer and fewer that know what they're doing, let alone fewer and fewer altogether, that their costs will go up too. The specific to dental hygienists do 2 years of school. They sometimes do a 4-year program to get their college degree with it. But a lot of times in Iowa, you know, by and large, when you're going to a community college for dental hygiene, and it's a 2-year program. The downfall to dental hygiene is there's a waiting list for it. And sometimes it can be 2 or 3 years. If you're thinking about it and you're close to graduating high school, I don't know exactly what the requirements are, but if you're close to graduating, find out from your local community college what the requirements are and get your name on the list if you're even just thinking about it. Then you can fulfill your typical undergraduate, what do they call those, Megan? Prerequisites, is that right? Yeah. So you can get done with your general ed, you know, kind of stuff. So that way, by the time you're done with your 2-year waiting list, or what happens if there's something opens up, you know, COVID is a weird kind of thing that all of a sudden it could have been a 2-year waiting list. Someone says, I can't go because I've got to take care of my mom. All of a sudden you're in. So, and dental hygiene is a pretty sweet job. I mean, you don't have the liability that an owner dentist has, and you still get a ton of patient interactions. You know, they get paid well. It's a happy kind of job. People actually want to see the hygienist. They don't want to see me. So yeah, it asks, what is your favorite part about my job? Listen, I pour myself out to people. I expend myself for people. So I love people. And that's probably my favorite part. At the same time, it exhausts me by the end of the day and the end of the week, but I mean, boo-hoo, that's just what happens when you get old. And I think I could reserve myself, but I don't. So I spend myself to my patients. Boy, if they ask questions, I'm willing to engage and follow up and send them pictures and shoot them an email of a website that I was talking about, you know, give them samples of something, because I want to care as much as any relationship. When someone cares way more than you do, it's a resentment problem. So if I care a ton about your teeth and you don't care at all, that's gonna be a problem, because am I gonna pay you to get your cavities fixed? You know, like how much am I gonna care versus you? Or if you care there's my hand. Yeah, if you care a ton and I as the dentist don't really care, you know, about your teeth, that's gonna be a problem. It's like, why am I paying him when he doesn't even care? So you want to match as a healthcare provider or any relationship. I don't care if it's, you know, a spousal relationship, friendship, coaching, and an athlete. You need to find someone that's going to match your level of care. And so I just love pouring myself out to people, and that's probably what I love most about my job. It's the most exhausting thing, but at the same time, it's the spice of life. Any other questions?
Okay, cavities. Is it because we don't brush our teeth well, or is it because we eat sugary items? Or is it both?
Yes. I will bring up caries. Okay, let's bring this up and share my screen. Where's share and do that. Okay, so there's a Venn diagram that talks about, and this might not be the right one. So, you know, there's Venn diagrams are circles that overlap. And this isn't quite the one I wanted. Let's go into this one. So there are three things that make a cavity happen. It's having time, and this isn't quite on your screen, so I apologize, but so in other words, if you're brushing after your meal and not letting it sit for hours on end, so time is one of the things that creates caries. Carbohydrate is the next thing. Carbohydrate is the fancy word for any hexane sugar that's going to feed bacteria. So any bacteria, they want to eat sugars, and I don't care if they're complex or simple sugars in your mouth. When your mouth has carbohydrate, the bacteria are happy, and they're getting fed and they're breeding and coming up with. So the third thing is acid. So if you don't have an acidic environment in your mouth, you can't get a cavity. If you have a basic environment, no cavities. You could eat all the sugar, but here's the interesting thing. The sugar in your mouth create a feeding ground for the bacteria. The byproduct from the bacteria creates acidity. So inherently, you get acid attack on your teeth, even if you're not chugging a Mountain Dew that is also acidic, which primes the pump. But you could eat something, you know, nice and natural and healthy for your system, and it's still going to attack your teeth because the carbohydrates are fermented by the bacteria and create an acidic environment. Way nerdier answer than you expected, but sorry, that's just the way it is. There's actually a whole course on it called cariology. Caries is our fancy word for a cavity, and what a depressing semester. But cariology is a horrible but important lesson, I guess, as a dentist. So if you don't have the cavity, the carbohydrate on your teeth for a long time, no cavities. If it's not acidic in your mouth, meaning that you, for example, if you were to neutralize the pH in your mouth with water, or better yet, with to buffer it with a sodium bicarbonate, baking soda in water, now all of a sudden you've got a basic environment in your mouth, no cavities. That's how dentists win. It's not just about brushing your teeth, it's also about how much time is that gunk on your teeth. And when someone says, I brush once a day, it's like, well, okay, so you time your hose, and you already have the carbohydrate that's creating an acidic environment. So now it's just a matter of time. The end.
Thank you. That was actually very helpful. I appreciate, no one's ever explained it to me. So.
Yeah.
Any other questions from our listeners and viewers?
If not, I'm just trying to think of anything else that you'd find interesting. I mean, I love my job because my job is way easier than a regular doctor, because like they're kind of told when to work. I mean, unless you have a day clinic job, then that's also, you know, more posh than working the hospital where you've got to like work night hours for years on end. No one wants to do that. And that's why dentistry is tough to get into. Yeah, right? Dr. Carr is like, yeah, that's see, so she's got to deliver, you know, babies or visit, you know, people, or even if it's a phone call. I rarely have to do anything at night. In fact, it's so rare that I have to do that it's my pleasure to actually do that when it happens. So like if your kid gets their tooth knocked out at a game on Saturday, you know, how that happens like once a year, twice a year. So when something happens and you know, someone will send me a Facebook message saying, hey, can you help me? Like, can you come take care of this tooth? It's not only my obligation, it's kind of like, I don't know, it sounds quaint, but it's my pleasure to really do that, because I think if I had to do that all the time, it would get old, you know. But like, and I'm just being honest, it would probably get old if it was like every night I had to leave my family. But Dentistry is a great family job. I work Monday through Thursday. Boo hoo. I get to talk to people like on this, and this is my like service. It's like, so what? You know, like this isn't hard. So what the problem is then is that makes dentistry very competitive. People go, oh, dentistry isn't as hard as medicine. Whether that's true or not, this is what people are thinking. You know what? Dentistry isn't as hard, and they get paid well, and I don't have to work weekends, and I get to own my own business if that's what you're into. Sign me up. Yeah, cool. And so it's actually very competitive to get into dentistry because it's almost like a subspecialty or a specialty from day one.
And there is only one dental school in Iowa, am I correct?
There is. I don't know what the count is right now for dental schools. I think we're over 60. There used to be 55, but over the last 10 years, they've opened some more dental schools. Interestingly, what the studies show is that dentists are more efficient than 50 years ago and 30 years ago, that we can take care of more patients than what they used to for an onslaught of reasons. But I mean, number one, 100 years ago, they started fluoridating water. So now, you know, like we don't even have the same cavity rate that we did before, but dentistry is still busy. Another example, our electric drills drill twice as fast as old air driven drills. So, I mean, we can just kick out a ton of dentistry more than they used to. So we're more efficient, and yet somehow they're kicking out more dentists into the world and stuff like that. I think because the baby boomers are getting ready to retire in dentistry. And so that's also an issue. And I hate to say, but I like dentistry does have a good burnout. So finding that quintessential old dentist guy that worked until he was 80, you know, back in the day, it's not happening as much, for better or worse. It is harder to get into dental school than medical schools. Yeah, the bottleneck is residency and what specialty you want to get into. Yeah, so dentistry kind of has this little niche that makes it more competitive because it's almost, and that's actually, not to put it down, but that's why a lot of people like going into orthodontics too, is because it's just the sweet little specialty that you're just kind of, you've got an easier job. And I'm not putting orthodontics down, but they would say the same thing if they were in good company. They'd be like, yeah, I mean, it's just a sweet gig. It really is.
I just realized that I know the University of Iowa has the medical school, of course, and the School of Dentistry. But I believe Creighton University would be the next school closest in Iowa, and they have both a School of Dentistry and I think a medical school also. Yep. I know they have a medical school. So.
Another close school for, depending on what part of the state you're from, because I know we're talking around the world tonight.
Yes.
So UMKC, so Kansas City, what's that? University of Missouri, Kansas City. So UMKC has a dental school. Minnesota has a dental school. I think South Dakota does. There are 2 schools in St. Louis. There are probably 3-ish in the greater Chicago area. Indiana, Ohio, Wisconsin, basically all your Big Ten schools are going to take care of the Midwest.
Any last question for either Dr. Johnson or Dr. Carr?
If there are people that are watching this remotely, and let's say later on you have any questions that you would like to direct to me, I put my email right there, chadbds@gmail.com. Really, there's not going to be a lot of takers. So I just shock myself sometimes by putting my personal email out there. But the fact is, if it's just 1 or 2 of you, which it will be, don't feel bad if you're the one person. Shoot me an email. And if you're in the Des Moines area and you'd like to job shadow, I love having people job shadow too. So yeah, come on through. And that's another cool thing is like, you know, Dr. Carr might not be able to have job shadowers from junior high, but I could, you know, it's a lot more of a kind of a homey feel with dentistry. We just ask the patient, hey, are you cool with that? And a lot of them are. So feel free if you're in the area. I see a question from Myrna. If someone has a tooth that's darker around the root, what does that mean? So your enamel is the part of the tooth, like an M&M shell that covers your tooth. Underneath that is dentin. Dentin is more porous. It's also got a higher collagen and lower mineral content. Sorry, this is the nerdy answer, but you asked. And
this is great.
So the root surface is a lot darker. And So naturally, if you brush your gums too hard and you have recession of your gums, your roots are going to be darker, and that's not necessarily unhealthy. They'll also pick up stain more easily because of the porosity of the dentin as opposed to enamel. So you definitely don't want to scrub your gums too hard to be brushing away your gums, and you want to keep your enamel. And so 2 words that I give for people for brushing: thorough but gentle. Someone asked, when did you decide to be a dentist and why? I got my front tooth hit playing basketball in 8th grade. And so I was one of those weirdos that actually since 8th grade wanted to be a dentist. And I just stuck with it. And I piggyback off of Dr. Carr's, one of my life words is perseverance. And listen, I'm not the smartest candidate to have been a dentist. There were people that should have been a dentist over me, but they quit. You can't become a dentist or a doctor if you quit, even if you're the smartest person. Bill Gates is not a doctor because he didn't go to medical school, but is he smarter than me? Yes. So I don't have any problem admitting that, but the fact is he's not going to become a dentist or a doctor if he doesn't go just baby steps, take the test, apply to school. If you don't get in, apply again. Maybe after 30 times quit, but not after the first or second time. If you're 80 years old and you're still applying to dental school, it's time to quit. But until then, keep it up. And here's my daughter, Sophia. Let's see your smile. Did you brush tonight?
I know I haven't yet, but I'm going to.
Okay, and this guy's gonna check.
And just like what he said, I took my MCATs and my entrance exams twice to get into medical school. I did an extra year of undergrad because I wanted to make sure that I had the good my grades are appropriate while I was applying for school. I know people who do something called post-bachelorette programs. I think people can do that for both dental and medical school.
Nice.
To get more science classes, they feel like they didn't do very well in undergraduate. There are people who work in between their undergraduate degree or go back to school to go into these careers. So there's lots of different options. And there's lots of different ways to get there, as long as if it's really what you want to do, seek out the help so that you can achieve what you want.
Persevere. The only person that's going to keep you from getting in for all due purposes is if you give up. Then it's for certain you're not going to get in.
Thank you for watching. For more information on Polk County 4-H